All right, what disease presents with golden brown rings around the peripheral cornea? Yeah, Wilson's disease. Where does copper deposit in the nervous system in Wilson disease? Basal ganglia, yeah. So what exam findings will you see with Wilson disease? Yeah, you'll see like atheosis and like kind of like Parkinsonian symptoms a little bit. All right, what this one's kind of obvious, so I'll skip it. Do you know what these rings are called?
Recording in progress.
Yeah, Kaiser-Fleischer rings. Good. All right, what condition presents with oh, we already did this. All right, what sign involves a bluish line on the gingiva? Yeah, Burton's line. So this is lead poisoning, the bluish line in the gingiva. All right, what condition is associated with short stature, Kaplan-Meier spots, thumb or radial defects, and an increased incidence of tumors, leukemia? They could also give you like a pure red cell aplasia. Yeah, Fanconi anemia. All right. What condition is characterized by red, pink urine, and fragile RBCs? They can also have like abdominal pain or DVTs or renal thrombosis. Yeah, PNH, good. Paroxysmal nocturnal hemoglobinuria. What's the defect in PNH? Yeah, good. CD55 and CD59. What do those code for? Yeah, which complement inhibitors? You guys know the names? It's I can give it to you. It's DIF and MERL, DIF and MIRL. Okay. What condition causes painful blue fingers or toes and then hemolytic anemia? And what antibody is it mediated by? Yeah, cold agglutinin, which is what? Yeah, IgM, perfect. Okay, what condition presents with petechiae, mucosal bleeding, and prolonged bleeding time? This is just thrombocytopenia, basically, is what I'm getting at. So anytime you see petechiae, you want to either thinking about vasculitis from RBC extravasation or platelet disorders like thrombocytopenia. All right, this is just B symptoms. Okay, what condition presents with skin patches or plaques, polytracheal microabscesses, and like epidermotropic atypical T cells? Nope. This one's hard. MF or so this is cutaneous T cell lymphoma. All right. What condition is associated with white blood cells that look smudged? CLL, good. What if they're in a like a clumped formation that kind of looks like rouleau? Yeah, rouleau formation. What's rouleau associated with? Multiple myeloma, good. All right. What syndrome presents in a neonate with arm paralysis and the waiter's tip position? Yeah, good. Erb's palsy. What's a deficit in Erb's palsy? Just is it upper or lower brachial plexus? Yeah, upper brachial plexus. All right. What signs associated with ACL injury? Yeah, anterior drawers or what sign's actually more sensitive and specific? Lockman sign. What condition presents with bone pain in an older gentleman, bone enlargement, arthritis, maybe sensorineural hearing loss, and elevated alk phos? Paget's disease of bone. What cancer is Paget's disease associated with? Yeah, osteosarcoma. Good. All right, what condition, this one, don't overthink this one. What condition presents with swollen, hard, painful joints in an elderly individual and pain is worse with activity? Yeah, OA. All right. What condition causes sudden swelling, podagra, or pain in the big toe joint? Yeah, gout. All right. What syndrome is associated with dry eyes, dry mouth, arthritis? Yeah, Sjogren's syndrome, which is associated with Rho and La antibodies. Does anyone know what the Roe and Law antibodies are measuring against? I think it's single-stranded RNA, but you should double check, Xander. All right. What conditions associated with urethritis, conjunctivitis, and arthritis in a male? Yeah, reactive arthritis. Used to be called Reiter syndrome, but he was a Nazi, so we don't say that anymore. All right. What disease is characterized by a butterfly facial rash and then Raynaud's in a young woman? Yeah, SLE. What antibodies do we get for SLE? Yeah, good. So start with A and A, most sensitive. Then you go to anti-Smith or dsDNA. Those will be more specific. And then dsDNA will be the one that you measure for disease activity. Other things you can get are complement, like C3, C1 through C3, or total complement, and then um, uh, ESR CRP will be elevated as well. What organ system do you watch out for in lupus? Kidneys, yeah. What's the DMARD in lupus? The disease modifying agent. Yeah, Plaquenil, hydroxychloroquine. I see methotrexate in the chat. Methotrexate is DMARD for rheumatoid arthritis. All right, what condition causes painful fingers, like in Wisconsin winter when you're changing from red to cold with stress? Yeah, Raynaud's, great. Here's an example of Raynaud's. How do you treat Raynaud's? What medication? Yeah, good, calcium channel blockers. Here's your room conditions and the associated antibodies. So this will be high yield. We'll share the slides, so don't worry about taking a picture. What conditions associated with anti-centromere antibodies? Yeah, CREST, good. Scleroderma, limited scleroderma, so CREST. What condition presents with skin nodules that are dark purple in a patient with HIV/AIDS? Yeah, Kaposi sarcoma associated with HHV8. All right, that's an example of a Kaposi sarcoma. You'll want to do a skin biopsy, but what other organ system is commonly affected by Kaposi sarcoma? GI tract, good. So you also want to do endoscopy. What condition is associated with antidesmoglin or antidesmosome antibodies? The antidesmosome. So I'll give you a hint, they're on the skin. Yeah, good. Pemphigus vulgaris. And then what condition presents with the 6Ps? Pruritic, purple, polygonal on the wrist, plaques. They might have Hep B or something. Yeah, LP, lichen planus. Good. What are the most common causes of elevated AFP in amniotic fluid or maternal serum? Yeah, I think I heard them all. So incorrect gestational age is the most common one, and then any cause of like neural tube defect, which can be caused by deficiency in what vitamin? Folate. Good. So anencephaly, spina bifida, and there's one more that we missed. Yeah, abdominal wall defect. So omphalocele or gastroschisis. All right. What conditions characterized by ataxia, nystagmus, vertigo, dysarthria? Don't overthink it. Just what part of the brain's affected? We're just localizing symptoms. BPV is a good thought. Any cerebellar lesion can cause this, or posterior circulation stroke. All right. What sign associated with toe extension or fanning on a plantar scrape? Babinski, yeah. And then what syndrome associated with hyperphagia, hypersexuality, and hyperorality? It's Kluver-Bucy syndrome, which is lesion in the hippocampus and amygdala. All right, what condition presents with resting tremor, atheosis, and chorea? A couple different things. The one I'm thinking of, basal ganglia lesion. So anything that affects the basal ganglia can present with this. The other one you want to think about is, are you gonna say it? Atheosis is like the it's like the snake-like kind of like movement, like writhing movements. The other one you want to think about is Creutzfeldt-Jakob can also present similarly with atheosis. All right, what condition is associated with a lucid interval after traumatic brain injury? Yeah, epidural hematoma. What's the concavity of the lens? Good. Lens-shaped hyperdensity on CT, on head CT. All right, what conditions associated with like thunderclap headache, worst headache of my life? Yeah, good. Subarachnoid hemorrhage. What condition presents with resting tremor, rigidity, shuffling gait, postural instability? Good, Parkinson's. What syndrome presents with cutaneous flushing, diarrhea, bronchospasm? Yeah, perfect. Carcinoid syndrome. What presents with hypotension, elevated JVP, and distant heart sounds? Yeah, what's this triad called? Beck's triad, cardiac tamponade. Very good. All right, here's carcinoid syndrome. You know the most common spot that's initially affected by carcinoid syndrome? Appendix is, yeah, appendix is the first commonly affected site, and then you usually don't get symptoms unless it affects what body part? Liver. Yep, perfect. Okay. What condition associated with chorea, caudate degeneration, dementia? I just brought it up. Or no, I didn't bring it up. It's a trinucleotide replete, though. Yeah, good. Huntington disease. Um, does, does anyone know the trinucleotide disorder? CAG, perfect. All right. What condition is caused by nystagmus, intention, tremor, scanning speech, and bilateral INO? MS, good. What tract is affected in INO? Intranuclear ophthalmoplegia. Yeah, MLF, perfect. Here are your trinucleotide repeat disorders. Here's a chart. Again, we'll share this so you don't have to worry about taking a picture, but super high yield to know these. All right, what condition presents with rapidly progressive limb weakness that is ascending following GI or upper respiratory infection? Yeah, GBS, Guillain-Barré syndrome. What conditions characterized by cafe-au-lait spots, Lisch nodules, cutaneous neurofibromas, pheochromocytomas, and optic gliomas? Yeah, NF1, neurofibromatosis type 1. All right, and then here is overview of NF1, chromosome 17 mutation, then NF2, super high yield to know. It's associated with schwannomas, especially bilateral, that can cause sensory neural deafness, cataracts, that's really high yield, meningiomas, and ependymoma. It's a mutation NF2 and chromosome 22. All right. And then here's retinoblastoma, which is a mutation RB1 gene. You'll have unilateral leukocoria, which is like the white reflection instead of the red reflex. And then tuberous sclerosis, we already talked about, mutation TS1 and TSC2, which are code for Hamerton and tuberin. And basically, you'll just have hamartomas everywhere. So that can involve angiofibromas of the liver, or angiofibromas of the skin, ash leaf spot, cardiac rhabdomyoma, which is a hamartoma of the cardiac myoepithelium, and then renal angiomyolipomas. And then Sjagren patches, which are technically plaques, but they're called patches for some reason. All right, what condition presents with a vascular birthmark or port wine stain of the face? Yeah, this is Neus flammus actually, but it's Sturge-Weber syndrome is also associated with. Okay, condition renal cell carcinoma, hemangioblastoma, angiomatosis, and PHEOs. Yeah, VHL, von Hippel-Lindau disease. It's also associated with, you really want to know it's high yield, it's hemangioblastomas in the brain. They can pop up as like bright spots that look like aneurysms on a brain scan. Okay. Here's an overview of VHL and Wilms tumor. Wilms tumor, high yield to know, Beckwith-Wiedemann and Denny-Drash syndrome and Weger syndrome. Is that everything? Yes.